So what do I do to prevent fibroids from coming back? It's a legitimate question. So I like to think of fibroids as cells that have lost the memo. They've lost the plot. They're not sticking with the program, kind of like a Manchurian candidate. Because they're kind of lost. They've either been influenced or they've been reprogrammed. They just don't know what they're doing. And we know that fibroids usually grow back. Why do they grow back after surgery? Why? Why is this such a common recurrence post-surgery? And it's really because the underlying root causes haven't been addressed. Like getting to the foundation of why they happen in the first place. Focusing our attention on the major risk factors. But I like to call them culprits because some of them are. And I'm going to list a few of them. One of them is your age. I mean, your reproductive years from like your late 20s or even your 30s down to like your 40s. You have a high surge of estrogen because that's the season of reproduction. Estrogen thrives in this season. And then you have your race. We know that Black women, women of color, are predominantly affected by fibroids. And you know what? It's crazy. Black women are 2 to 3 times more likely to have fibroids than white women. And more often, the fibroids are bigger or larger, and they're usually more symptomatic. Yes, that's what the research says. And also, fibroids are 3 times more common in African American women and 2 times more common in Hispanic women compared to white women. So Black women and Hispanic women would have a higher recurrence or a higher occurrence of fibroids. And there's a reason. And the clue is in genetic polymorphisms. That's science speak. But this needs a whole separate video, which I'll be making sometime. Another factor is being overweight, obesity. Yes, that's a thing. Hypertension as well. And vitamin D deficiency. It's actually not a vitamin, like it should be called hormone D because it's actually a hormone. And another factor is hormonal imbalances, which is a skewed estrogen to progesterone ratio, cortisol, or high insulin. Another one is exposure to endocrine disrupting chemicals, EDCs, especially at a young age. BPAs in plastics, parabens in our skin and hair care products, and also lifestyles involving like diets that are not so great. Have I also mentioned, being sedentary, lack of physical activity, not moving, miss, I love my bed, I love my couch, it's very comfortable, you need to move. And high stress as well. But these go on to affect inflammation, pathways that repair damaged DNA, and it just, causes genetic instability that actually leads to the pathogenesis, which is science speak for beginning or origin story of fibroids. Another thing is that the recurrence rate of uterine fibroids is extremely high. Recurrence after surgeries. And there's usually the need for additional surgeries a couple of years down the line. Fibroids have a 15% recurrence rate, and 10% of women who have gotten a myomectomy will eventually require a hysterectomy within 5 to 10 years. That's actually really crazy, like when you think about it. Surgery isn't it, if you ask me. It's temporary-ish, it's invasive, and it's expensive. How many surgeries are you going to have for every recurrence that you experience? Like how many? Exactly. They give you relief when you need it, but then you need to be thinking ahead, like what's next? Like ask that question. So what do I do to prevent fibroids from coming back? It's a legitimate question. The answer is you have to put in the work, sis. You have to. These blighters thrive when our bodies are out of sync, when they're out of whack. And to be honest, prevention is the name of the game, especially for women who are worried about fibroids coming back after surgery. Don't play with this phase. After surgery, this is where you have to put in the work. You need to work on what you're going to eat. Preferably stick to a fibroid preventative diet. You need to see a nutritionist, a qualified one who knows what they're doing. Additionally, you also need to include exercise. You need to manage your stress and also get medical guidance as well, because these things go a long way in improving your health and potentially reducing the risks of recurrence. So important. But you have to put in the work, sis. You just have to. There's no shortcut. There's no Ozempic for fibroids, at least for now.